Welcome to this talk on memory enhancement. I'm Dr. Trish Murray, physician, best-selling author, and the Health Catalyst speaker. Do you ever stop and think about your memory? Many of us focus on our physical and emotional well-being, but memory deserves just as much attention, as without it, our memory can start to slip. And with enough deterioration, Alzheimer's disease and dementia can begin to develop. The good news is that with attention and lifestyle changes, there are things you can do to start protecting your memory, and we will be taking a close look at just how you can protect your memory in this talk. But first, let's explain how some disturbing statistics about memory loss today, and then discuss how the memory works. So Alzheimer's disease and cognitive decline, folks, there are some devastating statistics now. It will affect over 50% of people in the 8th decade. It is the 7th leading cause of death. Now look at these statistics. It affects 10% of people in their 6th decade, 25% of people in the 7th decade, and 50% again today of people in their 8th decade, which means people are losing their history, they're losing their personality, they're losing their ability to interact with family and friends. Now, folks, this is not normal. You know, we should not be having these levels of statistics. And the most important message I can give you today is that the process that causes Alzheimer's disease and cognitive decline starts decades before noticeable symptoms are ever experienced. So if you really want the best chance to avoid Alzheimer's disease and cognitive decline, you must start now and not wait. And if no matter what decade you're in, you have to start thinking about your memory and you need to start protecting it. So how does memory work? Well, the Peak Performance Center states that, quote, memory is the mental function that enables you to acquire, retain, and recall sensations, impressions, information, and thoughts you have experienced. The amount of time memory is available to us is broken down into essentially 3 stages. The first one is sensory memory. The second stage is called short-term memory. And the third stage is called long-term memory. This sounds pretty straightforward, but let's take a closer look at each of these stages. Sensory information refers to the information received through our 5 senses. This is the first stage of memory, and it often lasts no more than a second or 2, actually. So the birds you watch cross the sky and then land on the top of a tree, while it is an action that you are sensing and perceiving, it may not be information your brain decides to store into either short-term memory or long-term memory. The primary types of sensory memory are, first of all, called iconic memory. Iconic memory is visual stimulation that forms a picture in your mind. An example of this is when you look at something and then you close your eyes, and for a brief moment, you can still see the image present before you ever closed your eyes. The other type of sensory memory is called echoic memory. And this is auditory sound waves that are sensed by the hair cells in your ears that then travel to the temporal lobe, which is a lobe of the brain. And an example of this would be hearing someone speak like you're hearing me now and hearing the sound of their voice and the details of the language but it's sort of fleeting over the air cells and through the memory. And the third type of sensory memory is called haptic memory, H-A-P-T-I-C, haptic memory. And this has to do with sensations the body feels, such as pain, movement, or any type of stimulation, such as an example would be the sensation of petting a dog. Now let's look at how short-term memory plays a role. Information in short-term memory is not stored permanently. Information passes from sensory memory into short-term memory, where again, it is held for only a short period of time. Most of the information stored in short-term memory will only be kept for approximately 20 to 45 seconds. Short-term memory is also known as the active or working memory, because while memories in this stage only stick around for a matter of seconds, it is here that the mind processes and encodes useful information to allow it to pass along into the next stage of memory, long-term memory. This stage sounds similar to sensory memory, but with sensory memory, the mind receives a complete image, whereas with short-term memory, it receives an individual's interpretation of an image. And now let's take a look at long-term memory, the mind's memory bank. Long-term memory refers to lasting retention of information. Psychologist Endel Tulving explained the levels of long-term memory by breaking it into three categories: procedural memory, semantic memory, and episodic memory. So let's talk about how these are different. Procedural memory is a part of long-term memory responsible for the unconscious ability to do things, such as riding a bike would be a really good example of procedural memory. You don't think about it when you get on a bike once you know how to do it, you just do it. Semantic memory is a part of long-term memory responsible for consciously storing information learned, such as word meanings, histories, and general information, such as knowing the state capitals would be a good example of this. And finally, the third type of long-term memory is called episodic memory. And a part of long-term memory, episodic memory, is responsible for consciously storing information about events experienced at some stage in your life. So remembering a childhood trip to the beach, for example, is an example of episodic memory. Now, considering these three categories, in what stage do you think the most breakdown occurs with memory loss or memory decline? The American Psychological Association studies have revealed a pattern of memory loss, most often occurring of those three types of long-term memory. The first to start going is the episodic memory, which relates to, as many people would experience, the trouble of recalling dates and times of certain events. The problem they have found is not the ability to store old and new information in long-term memory, but rather a problem with accessing or retrieving the stored information. There can sometimes be interference that prohibits your ability to access and retrieve information. Now let's take a look at why does this stuff happen? Why do we lose memories, or why can't we bring them up in our brain? Well, Dr. Dale Bredesen, who is an MD, has authored over 200 scientific papers in the peer-reviewed literature. He worked throughout his career with a Nobel Prize winning laureate in the area of neurological disease discovery. He has pioneered pathways of understanding through research about neurogenesis and plastogenetic effects that relate to nervous system function, to cell signaling, and to the relationship of neurological development. Dr. Bredesen's first book, entitled The End of Alzheimer's, explains a lot of the research about root causes of brain degeneration. Now, again, I want to try and make sure that one of the biggest things folks walk away with tonight is this idea of the temporal or the time span in which cognitive decline occurs. Cognitive decline, folks, does not start at 65 or 70. It started decades before, years before a person starts to have definitive symptoms. So if the concept of temporal progression of cognitive impairment means that we all are aging. We can't do anything about that. And when it comes to cognitive decline over years, there is what's called the preclinical stage, the silent phase, where the brain changes, but you're not even aware of the fact that you're having some decline. In this stage, the preclinical stage, individuals may notice changes here and there, but they're not detectable on any tests. Like a person can take a cognitive decline test and do very well. The preclinical stage is also a stage where the patient knows maybe and is starting to be aware, but the doctor doesn't. And also in some of the preclinical stages, the patient doesn't know either. So time goes by, and then what happens is the more symptoms occur. And mild, MCI stands for mild cognitive impairment, which means cognitive changes that are of concern to the individual become more frequent, and also family members start to notice as well. One or more of the cognitive domains are impaired significantly and are obvious to other people and to the patient and in a test. However, with mild cognitive impairment, usually a person's daily living activities like showering and cooking and cleaning the house and paying bills is still fine. And that's mild cognitive impairment. But again, if you don't do anything about it and you don't improve on things, over more time goes by, and then mild turns into moderate, turns into moderately severe, and turns into severe dementia, where cognitive impairment severe enough to interfere with everyday abilities, ability to interact with others, ability to do activities of daily living, get worse and worse if you're not doing something in order to try and reverse it. So obviously, this is what we want to try and avoid. We want to stay on the green trajectory of normal aging, where yes, slight cognitive changes do occur with age, but not to the point of causing us to lose our personality, lose our knowledge of who we are and our memories and our ability to take care of ourselves. Now, it is usually around the fourth decade, 40 years old or 40 something, when people start taking note of subtle changes in their ability to multitask or to remember new information. And this is a sign that key areas of the brain responsible for memory are starting to shrink or atrophy. And again, folks, we need to do something about this now, not wait. At this point, there is typically a significant reduction in connections among neurons. And if you are starting to notice this in your fourth decade, or in any decade for that matter, then you need to start taking action to stop the degeneration now and not wait, because it will get worse if you don't do something about it. You see, as the brain changes, so does behavior. And so, given that blood flow drops the most in the front of the brain, the frontal cortex, People most commonly experience declines in their ability to have verbal fluency or the ability to find the words they want. They also have to work harder at executive functioning, planning and organizing their activities. So maybe you are wondering if this is simply the effect of aging, or is there anything you can do to protect your memory as you age? Because you see, throughout our lives, there are many systems in our body that function and are based on a balance between growth and degeneration or death of cells. The image here of a wall of bricks with one man at the top adding bricks to the wall, while at the same time another man at the bottom is breaking and destroying bricks, is a concept that happens in the body all the time. But when it is out of balance, it can lead to many different chronic illnesses. And when we talk about the brain and the neurons and the nerve cells in the brain, then we talk about cognitive decline. So let's take a closer look at how this works in the body. Now, blastic and clastic. There are blasts and there are clasts. And blastic and clastic signals are exactly that, signals in the body through cells or proteins. Now, blasts cause the production or buildup of a certain type of cell or tissue. And clasts cause the death or destruction of a certain type of cell or tissue. So osteoporosis, let's talk about bones. Osteoporosis, for example, happens because as we age, an imbalance develops between osteobone blasts, so osteoblastic cells that add to bone and make it stronger, versus osteoclastic cells that signal for bone to be depleted. The osteoclastic signaling is more prominent or powerful than the osteoblastic signaling as we age, and so our bones become more brittle and leading to the causes of osteoporosis. Another example of this imbalance or balance in the body can be, an example is cancer, cancer occurs because certain cells are being signaled to overproduce in an abnormal amount, and the growth of a tissue is not balanced by the cytoclastic signaling for cells to die, actually. Old cells should die off and new cells should be born. And if that's not in balance and the old cells are not dying off and degenerating, a tumor can form due to the abnormal growth that is occurring. And thirdly, Alzheimer's disease is a degenerative process in which nerves and their synapses, the way they communicate with each other, are being broken down or degenerating more than new nerves or synapses are being produced. Therefore, there is more synaptoclastic signaling than there is synaptoblastic activity or signaling. So I hope you're following these examples. Now let's take an in-depth look at the mechanism that promote the specific signaling in Alzheimer's disease to destroy nerves rather than produce them. And in order to understand this mechanism, we must talk about and understand the amyloid precursor protein. The concept of the amyloid precursor protein is presented by Dr. Dale Bredesen in both of his books to help us understand that the environment our nerve cells are living in every day is what initiates the signaling for either nerve cell production and health or nerve cell degeneration and destruction. And this balance needs to be in balance. If it's out of balance, then that's why we get into trouble. And this signaling is happening throughout our lives and does not start only when we are at a specific age. It's going on throughout all of our decades. So the progression towards Alzheimer's might start in our 20s or our teens for that matter. So at the heart of Alzheimer's disease is a switch called the amyloid precursor protein. And this is a receptor. And this receptor protrudes from the membrane of our brain cells. And this brain receptor responds in two ways, depending on the environment it's living in. You see, when there are optimal levels of nutrients, optimal hormone balance, optimal growth factors, there's no infections or pathogens, no inflammation, and a good response to insulin because not insulin resistance, and low to no levels of toxins present, then the amyloid precursor protein in this healthful environment is cut at one specific site to cause a growth signal for nerve cells and synapses, and promotes what? Promotes brain growth and brain productivity. On the other hand, if the environment your brain cells are living in all the time is depleted of nutrients, depleted of hormones and growth factors, if the nerves are exposed to infections or pathogens, if there is inflammation, if there is insulin resistance, if there's an overabundance of toxins, then what's going to happen? Then a downsizing synoclastic message is created by the amyloid precursor protein being cut at 3 sites. And being cut at 3 sites, this produces 4 fragments, one of which is the amyloid beta peptide. And the amyloid beta peptide is what is associated with the creation of amyloid plaques in Alzheimer's disease. And these 4 fragments signal a downsizing synoclastic effect in the brain, which destroys memories and brain potential. So if you look at the slide that's here with me, and if you've been following along, in the middle, you have a full blue amyloid precursor protein that's sticking up out of the membrane of a nerve cell. If it is cut once at only one site and you go to the left, that is the anti-Alzheimer's disease direction, and it is promoting cell growth and cell health within the brain, and the nerves will remain optimal and functioning. If the environment that receptor is living in is an unhealthy environment, then it will get cut and you will move to the right, and that receptor will be cut in 3 places. You'll end up with 4 different fragments, and those fragments signal the degeneration and the breakdown of nerve cells and nerve cell synapses, and you will go down the path towards cognitive decline. Now, Dr. Bredesen uses an analogy of a roof with many holes in it. So you see an image here of like a barn, and if you look at the roof, there's all sorts of light coming through the roof through different size holes. And if you focus on filling only one of the holes in this roof, you are still going to have a really leaky roof. And that's the point that Dr. Bredesen is making, is traditional medicines for decades now for Alzheimer's disease has been looking for the one bullet, the one pill, let's say, that is going to solve the problem of Alzheimer's disease. And folks, it just doesn't exist, because as Dr. Bredesen's analogy is showing you, if you have 36 holes in your roof and you only fill 1 or 2 of them, you're still going to have a really leaky roof, and your memories are going to be leaking out. Now, through all of the research, Dr. Bredesen has outlined as many as 36 different metabolic factors that can trigger the downsizing in the brain, meaning cut that amyloid precursor protein in 3 places rather than 2. And he refers to each of these 36 metabolic factors as the different potential holes in your roof. And one needs to work on filling or fixing as many holes or metabolic imbalances as absolutely possible. To what? To stop the leaking. Now, in order to help individuals identify their metabolic imbalances to work on, Dr. Bredesen and a company he created with other people called Apollo Health have created a prospective study on patients enrolled in a program they've started called, and they've been doing for years now, called the Recode treatment protocol. And anyone can do Recode. Now, they originally called it Recode for reversal of cognitive decline. They now have called it both Recode if someone has started cognitive decline, so to reverse it, but they also speak of Precode, meaning prevention. So you notice there's reversal and there's prevention in Recode and Precode evaluation. And what the point is to help every individual through their program identify your individual metabolic imbalances and then learn how to improve them. Now, the objective of the study is to determine if Recode treatment has a measurable impact on the typical progression in neurocognitive decline observed in patients with Alzheimer's disease and patients who are exhibiting mild cognitive impairment. Now, I have trained in the Recode protocol program and work with many patients on a regular basis to improve their metabolic imbalances and improve their memory and reverse cognitive decline. Now, Recode is the first program ever to report the reversal of cognitive decline in patients with early Alzheimer's disease. And it includes a metabolic and genetic laboratory assessment in order to generate a personalized and individualized Recode report. Now, with all of this that I'm sharing about Dr. Bredesen's program called the Recode Protocol, if you want to learn more about this particular program, you can go to apollohealthco.com. So it's Apollo Health Company, or, short for company, of course, is CO. So apollohealthco.com, or just Google Recode Protocol and Recode Protocols Dr. Bredesen, and you're going to find an enormous amount of information and lead you to understanding more about this program. Now, Dr. Bredesen's second book, because he's written 2 different books on his program, the second book is entitled The End of Alzheimer's Program, the first protocol to enhance cognition and reverse decline at any age. Now, in this book, his second book, Dr. Bredesen discusses the specific steps to take to reverse and or prevent cognitive decline. So he talks more about what to do in order to reverse or avoid Alzheimer's disease. Now, the biggest message also through this program, folks, tonight, and to have you understand, is that there is hope. What you need to understand is that what you do to your body, you do to your brain. 95% of all illness or dis-ease is either caused or worsened by numerous things in our everyday environment. The level of stress we experience, whether we have either food allergies or food sensitivities that we're not aware of and we're eating these foods on a regular basis, leaky gut, poor nutrition, metabolic imbalances, toxins, inflammation, immune imbalances, and hormone imbalances. So you notice again, multiple different imbalances within one's environment, causing holes in our roof and leaky roofs and leaky brains. Now, the National Institute of Aging states that while there are many things about the aging process affecting memory that is simply the result of an aging body and mind, there are still many factors within our control that you can take control of and modify that contribute to retaining your memory. And some of the most important ones are these: adequate sleep, stress reduction, regular exercise, healthy diet, and exercising your brain, not just your physical body, but creating new experiences in your life so that you're exercising your brain. So let's spend some time now and take a closer look at how these contributing factors, when they are out of balance, can have a negative effect on our memory. Now, a person by the name of Elizabeth DeVore, who is an instructor of medicine at Harvard and the affiliate Brigham and Women's Hospital, reported in a sleep study that her team's findings, quote, suggest that getting an average amount of sleep, folks, that's 7 to 8 hours per night, may help maintain memory in later life, and that clinical interventions based on sleep therapy should be examined for the prevention of mental impairment. Another medical provider, Dr. Howard Lewin, chief medical editor at Harvard Health Publishing, attributes lack of sleep to multiple chronic diseases: high blood pressure, diabetes, narrowed blood vessels, all of which can contribute to a weakened blood flow to the brain and cognitive decline. Additionally, lack of sleep deprives the brain the optimal time it needs to catalog and store your memories, the time it needs to detoxify, as well as the time it needs to regenerate. So allowing the mind to process new experiences and access memories. So how do you get more sleep? Well, the Better Sleep Council suggests you can make 8 hours of quality sleep a regular part of your life by scheduling it. Make sleep part of your to-do list and plan your bedtime like you would any other appointment in your life. You wouldn't miss a meeting to binge watch TV, would you? Be strict about your sleep appointment in the same way. Keep a consistent schedule for sleep and wake times, and soon they will become just a part of your everyday routine. Support your schedule by creating a bedtime routine that relaxes you with things like hot baths, good books, or soothing music. Now, I recently did a webinar, I believe it was just last month, entitled Overcoming Your Insomnia, during which I went into great detail about options for improving your sleep. And you can access that talk if you want to listen to the entire talk, either by going to my Discover Health podcast, or you can go to our Discover Health Functional Medicine Center YouTube channel, and you'll find that talk in either place. But here's a list of options to consider to optimize your sleep. 1, do not eat or have any alcohol at least 3 hours before sleep. No caffeine after 2 o'clock in the afternoon. Limit intense exercise to at least 2 hours before bed. You see, intense exercise stimulates our brain and won't allow us to quiet down. Do not use a computer, a phone, or a tablet in bed, and turn it off completely at least 30 minutes before going to bed. And try some stress relieving exercise. You can do exercise, but they should be stress relieving exercise like gentle stretching or yoga before bed. So when you can't sleep, what do you think is the primary cause? most of the time, it has to do with stress. So how does stress affect your memory? Stress elicits a response from the body by telling the brain that you are in danger. And the body responds by releasing a hormone called adrenaline into the bloodstream. Adrenaline works to increase your heart rate and blood pressure to support the fight or flight impulse. This is great if you are in danger, but in our modern era, we are all constantly in a state of arousal, and this can lead to long-term anxiety and fear, which are stressors known to have a negative effect on your memory. Remember, they're going to cause that amyloid precursor protein to get cut in 3 different areas and cause a signal to degenerate the brain and the neurons. Additionally, stress can activate the pituitary gland to release a hormone called ACTH, which then goes down and activates and turns your adrenal gland on, telling it to dump cortisol into your bloodstream. While cortisol can have beneficial effects when it comes to relieving stress, it binds to cells in the brain's hippocampus, which is the area responsible for converting new experiences into memory, and also tells the amyloid precursor protein to get cut in 3 places, thus disrupting and causing a degenerative signal and disrupting the memory forming process. So do you make stress management a priority? Now, with over 75% of doctors' visits being due to conditions caused by stress, it's easy to see why learning some stress reduction techniques is good for your overall health. Not to mention as a preventative measure when it comes to reducing your risk of developing dementia. So let's talk about some tips for reducing stress. Now, exercise is at the top of the list. Exercise is a stress reliever as it works as a natural remedy for anxiety by releasing endorphins. Endorphins are the body's built-in mood enhancers in the brain. Exercise also, if done, not right before bed, but a couple hours before, of course, also help improve your sleep. Now, exercise also increases in your brain a very important Miracle-Gro chemical. And that Miracle-Gro chemical is called brain-derived neurotrophic factor, or BDNF. BDNF, or brain-derived neurotrophic factor, has been found to be better than any antidepressant in decreasing and treating depression. It is also in research to be found that the areas of the brain most associated with aging and cognitive decline are most affected by BDNF and by exercise. Research has also shown that seniors who throughout their lives have consistently engaged in some form of physical activity are better able to maintain their cognitive function, their ability to have focused attention, and their memory compared to their sedentary peers. Now, another thing you want to work on in order to reduce stress is meditation. And there are so many reasons why meditation is beneficial. I'll list a few for you here. Number 1, meditation is a proven stress reliever that eases anxiety, and when practiced regularly, results in a feeling of overall improved well-being. Meditation has been shown in research that in studies to reverse body age by 8 to 15 years. Wow. So if you say to somebody, that's 65, oh my gosh, you only look 55, they may be because they are meditating and exercising on a regular basis, and so it decreases their body age by as much as a decade. Another thing that meditation can do is it lengthens what are called telomeres. Telomeres, folks, are a protective aspect to your genes in your genetics. And as the length of telomeres shrinks, it signals degeneration to your genes and puts you at more risk for aging, of course, and genetic diseases. So you want your telomeres to stay as long as possible, and meditation has been shown to optimize the length and maintain the length of telomeres in your genetics. A fourth reason to meditate is to decrease adrenaline and cortisol, which of course are the primary causes of anxiety, depression, and brain fog. And finally, meditation increases dopamine and serotonin, which cause calming and clarifying symptoms and optimize brain function. Now next up, let's give you some specific steps to follow to try and practice meditation. So finding stress relief is a continuous journey. Meditation is a great stress relieving practice, and it can essentially be done at any time in most anywhere. All you need is just a few minutes and a relatively quiet place. If you are new to the concept of this practice of doing meditation, then try these meditation steps to get you started. Your mind and your body will thank you. To perform any meditation, you're going to want to find a comfortable position. Now, just sitting in a comfortable chair is fine, or you could lay down. But if you are sitting in a chair, you're going to want to keep your back straight, but not rigid. You don't really want to slump. And you want your hands gently resting in your lap or on your thighs. You're going to typically close your eyes in order to shut out the world and take notice of your body. What is the shape of your body? Notice its weight in the chair. Notice how your body feels. Scan your different parts of your body. Then, slowly become aware of the sensations around you in the outside world. And then, turn your focus of the sensations inward into your inside world. And relax any areas of the body that you notice are feeling tight by breathing into those areas of the body and asking them to relax. The other thing you want to do in order to help you meditate is give the mind something to focus on. And the best thing to focus on in order to be successful with meditation is to tune into your breath. Allow your breath to come in and out naturally, and notice where you feel it in your body. Now, you might notice that your mind may start to wander, and this is natural. Acknowledge your mind for wandering and bring it back to focusing on your breath. You can also give your mind something to do and count your breath. So as you inhale, count to 5. And then as you exhale, count to 5, or even count to 6 or 7 when you exhale. But the bottom line is, as you breathe in, count the inhales and count the exhales. From time to time, you'll get lost in thought, and again, your mind will try and wander. And when you do, again, return your mind to what? Return your mind to your breath. And try and stay in the experience. You could start out trying for only, let's say, 2 minutes. And then over time, increase to 3, increase to 4. And before you know it, folks, you'll be doing this for 5 to 7 minutes a day. And 5 to 7 minutes a day would be the perfect amount of time to be doing this. If you can do it longer, great. But if you're at least doing it for a minimum of 5 minutes, it will start to have an effect and quiet your stress. Now, according to Harvard Health Publishing, exercise helps memory and thinking through both direct and indirect means. The benefits of exercise come directly from its ability to reduce insulin resistance, reduce inflammation, and stimulate the release of growth factors. Again, remember, chemicals that the brain will find healthy and will turn on will only cut that amyloid precursor protein at one site into two fragments and promote growth of your neurons of your brain. Now, indirectly, exercise involves mood and sleep and reduces stress and anxiety. Problems in these areas frequently cause or contribute to cognitive impairment. Additionally, many studies have shown that the prefrontal cortex and the medial temporal cortex, these are parts of the brain responsible for thinking and memory, have greater volume, meaning they're bigger in people who exercise versus those who do not. And all of these reasons and more are why we created Discover Health Movement membership. Folks, if you are not exercising optimally, or you are looking for a new variety of how to exercise differently to optimize your cognition and your brain function, Discover Health Movement membership is an online exercise program. You don't have to leave your home. During this pandemic, of course, we've all been online and we know how to work the computer more than we ever have before. So with our online exercise program, Discover Health Movement membership, we offer 3 classes a week. One class is called Discover Yoga. Another class is called Movement for Longevity, and it focuses on balance and strength. And a third class is called Self-Myofascial Release, and it teaches you how to use balls and rollers to unwind the knots in your own connective tissue. So again, if you are looking for a regular exercise program you can do at any time from the comfort of your own home, or you wish to do the real online time or the real time online with our instructors, then all you got to do is go to discoverhealthfmc.com/#movement. Now, another extremely beneficial form of exercise to boost your levels of brain-derived neurotrophic factor, that BDNF that I spoke of earlier, is aerobic exercise. Aerobic exercise is exercise that gets the heart pumping, such as brisk walking, running, or cycling. So doing a variety of exercise in your life is very important to optimizing your brain function. Studies have actually shown that partner dancing, for example, is one form of exercise that is optimal for boosting brain function and helps prevent cognitive decline. Now, enough about exercise. Let's talk about a healthy diet. Because just as exercise, stress relief, and improved sleep can help protect you or rebuild your memory, diet plays an extremely important role as well. And a UCLA study published in the American Journal of Geriatric Psychiatry found that the Mediterranean diet is one of the main lifestyle factors that seem to keep the brain from developing the toxic plaques and tangles associated with the development of Alzheimer's disease. And again, plaque refers to the deposits of a toxic protein called beta amyloid protein in the brain, which has been linked to the development of Alzheimer's disease. And remember, that's the promotion and the signaling to the development of those plaques, and that beta amyloid protein is due to the environment your brain is living in every day and causing that amyloid precursor protein to get cut in 3 places. And you don't want that to happen. So when you think of the Mediterranean diet, what comes to mind? Well, the food staples of the Mediterranean diet include fresh fruits and green leafy vegetables, olive oil, nuts and seeds, beans and legumes, herbs and spices. So be very, use a lot of variety of spices to spice up your foods and your meals. Wild caught fish, pasture raised poultry and eggs, and whole grains. But folks, in relation to whole grains, I will recommend that you limit them to only 1 or 2 servings of grain a day, period. Because remember, all grains get converted to glucose or sugar in your body, and glucose is a neurotoxin. It destroys brain cells. Now, the diet that Dr. Bredesen promotes through his Recode or Precode program, I also want to share with you. And this diet is the diet that he promotes through the Recode program or the Precode program to prevent or reverse cognitive decline, and it's called the Keto Flex 12-3 diet. Now, this is a ketogenic diet, and a ketogenic diet is a diet which a person avoids all grains and sugars, and instead of using glucose or sugar as a fuel for energy, a person on a ketogenic diet shifts their body instead to use fats for energy or fuel, and what fats produce are called ketones. So the basic concepts of this Keto Flex 12-3 diet are as follows. Number 1, at the bottom of the pyramid of this diet is fasting, actually. They recommend that you would fast 12 hours from the time you eat your supper or your evening meal. You would not eat anything after supper, and until breakfast the next morning every day or every night, every 24-hour period, you would fast for 12 hours. And you could make it anywhere from 12 to 15 hours, but the diet is called Keto Flex 12-3. So it essentially recommends 12 hours of fasting. Number 2, the next level of the pyramid, you'll notice, is primarily eating non-starchy vegetables and healthy fats. So lots and lots of greens, avocado, nuts and seeds, olive oil, again, that Mediterranean diet. Number 3, the next focus up is high fiber foods like prebiotics and also probiotics, which are fermented foods, and resistant starches. Number 4, the next category in the Keto Flex food pyramid is animal protein and low glycemic fruits. So you'll notice berries, blueberries, strawberries, raspberries. Berries are a very low sugar fruit. So those would be high on the list to eat on the Keto Flex 12-3 diet. Finally, a few indulgences at the top of the pyramid, such as occasional red wine, specific sweeteners that do not increase your blood sugar are listed, such as stevia or something called monk fruit. And dark chocolate that would necessarily be unsweetened is also allowed because of the coca flavanols in it. Now, the one thing I haven't covered is what's the 3 mean? The Keto Flex 12-3. What does the 3 mean? The 3 means that, again, you would eat your evening meal, and for 3 hours, you would eat your evening meal at a time in the afternoon or evening that is at least 3 hours before you go to bed, so that you haven't eaten any food for 3 hours before you try and go to sleep. So the Keto Flex 12-3 is the primary diet, again, that's recommended through the Recode protocol that Dr. Bredesen has created in order to help people reverse cognitive or prevent cognitive decline and optimize the retention of our memory. Now, were you aware that nearly every minute that goes by, someone develops Alzheimer's disease in the United States? That is a shocking statistic. But as we have seen, there are some things we can do to protect our memory. While eating a healthy diet is a key, That also means that on the flip side, there are some foods to avoid to reduce the risk of developing Alzheimer's disease. So let me list a few at the very top of the list. Number one, wanting not to eat very often is red meat. The iron in red meat is a great addition to the diet, but too much red meat can mean a buildup of iron in the gray matter of the brain, which is the area of the brain that typically shows the first signs of degeneration as we age. So limit red meat. What's the second food you want to either avoid or limit? Refined carbohydrates and sugars, as we just saw on the Keto Flex 12-3 diet. Carbs and sugars raise glucose and insulin levels, which causes a spike in blood sugar. Over time, this can lead to insulin resistance and damage to blood cells in the brain responsible for memory. And the third thing you want to limit or completely avoid is alcohol. Alcohol is a toxin that is degenerative to the brain and can be a primary cause of high blood pressure. So alcohol is a toxin to the brain, and you want to limit it or completely avoid it. Now, while your memory is not a muscle, it can atrophy when it is not receiving adequate exercise. So how do you exercise your memory? Well, by engaging your brain in activities that increase your mental effort, you can exercise your brain. And in this day and age, we have become more reliant on our computers and mobile devices to store our personal information, phone numbers, and even important dates, and less reliant on our memories to recall that information. So in an effort to increase your memory and to reduce the risk of developing Alzheimer's disease and dementia, it is important to play an active role in how you exercise your memory. So let's look at a number of different great memory boosting exercises. One way to do it is to test your recall. So make a list of grocery items or things to do or anything else that comes to mind to make a list of, and memorize that list. And an hour later, go back and see how many of the items you can recall and that you remembered, and do this on a regular basis. Another option is to learn to play a musical instrument or join a choir. Studies have shown that learning something new and complex over a longer period of time is ideal for the aging mind. Another is to do math in your head. Figure out problems without the aid of pencil, paper, or computer. Another, take a cooking class. Cooking uses a number of senses: the smell, the touch, the sight, and the taste, which of course all involve different parts of your brain. Next, or another option, learn a foreign language. The listening and hearing involved in listening and hearing a foreign language stimulates different parts of your brain. And what's more, a rich vocabulary has been linked to a reduced risk of cognitive decline. Next, create word pictures. Visualize the spelling of a word in your head. Then try and think of any other words that begin or end with the same two letters. Next, draw a map from memory. After returning home from visiting a new place or a friend, try to draw a map of the area that you just traveled, and repeat this exercise each time you visit a new location, and get in the habit of doing this, and it will improve the brain. Next, challenge your taste buds. When eating, try to identify individual ingredients in your meal or what you're eating, including trying to identify the subtle herbs and spices in the food. Next, Refine your hand-eye coordination. Take up a new hobby that involves fine motor skills such as knitting, drawing, painting, or assembling a puzzle. Next, learn a new sport. Start doing an athletic exercise that utilizes both mind and body, such as yoga, golf, or tennis. And I will tell you that in our Movement for Longevity class in particular, it forces my brain to stay focused every time I take that class, and I am sure it is helping my memory. The other thing, of course, is you can take a dance class that involves dancing with a partner, because again, research has shown that maintains memory. And the last option here that I'll talk about tonight, or list for you, there are also online programs that are specifically focused on exercising the brain and one's memory. One program, and you can look them up and Google them, one is called Brain HQ, so brain, the letter H and the letter Q, or another one is called Lumosity, Lumosity, Lumosity. And these are only two of many different sites out there that have brain games that you can practice online. Now that was quite a list. So please think about which ones have enticed you and think about which ones you should start trying to implement to maintain your optimal cognitive function. So, as you can see, optimizing one's memory is not going to happen by taking any type of pill. It takes effort and focus on an overall healthy, non-toxic lifestyle that incorporates beneficial habits in a variety of categories that you see on this slide. It has to do with sleeping well and stress management and diet and brain exercises, and supplements are involved, emotional, spiritual wellness, all of it. Now, and if after listening to this talk, you are feeling in need of either a complete overhaul or just a bit of fine tuning, then do not miss out on our next Nutrition and Healthy Habits online class that will be starting in just another week or two. On Tuesday, April 27th, health coach Trish Chappett from my office will be leading this class, again entitled Nutrition and Healthy Habits. It will start on Tuesday, April 27th. It is online. It will be a small group Zoom program, and it will be limited to only 10 people. So don't delay. To register, either contact Coach Trish by emailing her at discoverhealthcoaching@gmail.com, or go ahead and just call our office at 603-447-3112. So thank you so much for attending this event. We hope this experience has left you feeling more knowledgeable when it comes to protecting your memory and ready to start taking some proactive steps for the health of your mind. And as we always do, for your further learning, we will post in our Discover Health Facebook group tomorrow a list of all the different resources that were used to put this presentation together for you. Now, if you're not already a member of our Discover Health Facebook group, and you do go to Facebook, then just go to my Discover Health Functional Medicine Center Facebook page. You'll see a place to click on to join our Discover Health Facebook group and just request to join. Everyone's welcome, but it is a closed group and you do need to request to join. And after every one of these webinars, we list a ton of resources that you could do further research and reading and learning from. So thank you so much for attending this event. It means a lot to be able to share this important information because the mind deserves protection. And with a little work, you can start reducing your risks of Alzheimer's and dementia today. And I hope you realize from this talk that one of the most important points is not to wait but to get started now. So please reach out if you have any questions or concerns. We are happy to help. In order to reach out to us, the most easy way to do it is to go to my website, discoverhealthfmc.com, or you can go to our Facebook group, Discover Health Facebook group, and request to be a member, and you can ask questions and communicate with us there. Or by all means, just call the office at 603-447-3112.